Hello and Assalamu alaikum. Ultrascan Diagnostics here. This is the CBCT full mouth of the patient that you had requested. The area of interest highlighted is the lower right wisdom tooth and the association of this tooth with the inferior alveolar nerve. Now, on a panoramic view, we can see that the inferior alveolar nerve is in very close approximation to the roots and the apex of the lower right third molar. Now, we will highlight on the transaxial view and we'll show you exactly how closely associated the tooth is with the nerves. Now, this is the mesial aspect of the grossly carious lower right third molar. We can see that as we move, this is the lower right third molar with its grossly carious nature. We can see that the nerve, as highlighted in this orange region, is actually present within the roots of the lower right third molar. And as we move distally, we see that the nerve canal gets compressed, and it is right in the middle of the root. And then as we move further distally, we can see that the canal regains its architecture. Now, for better understanding, we are just going to remove the highlight and we're going to take you through the mesial to the distal aspect one more time. So for our kind doctors, I'm going to zoom in. This is the lower right third molar region, the transaxial view, or for better understanding, the proximal view. This is the ID canal. We can see that it has its complete architecture. This is the cortical plate. Surrounding it, we've got the lingual cortical plate, the buccal cortical plate. As we move towards the lower right third molar, we see that the inferior alveolar nerve canal just goes slightly superficially and is now present between the roots of the third molar. And here we can see that the canal compresses, and this is a classical indication that the root is in contact, is in very close contact with the ID canal. And then here we can see that the loops, even though are not completely looping against it, but we can see that the buccal root does actually go right below, and here the inferior alveolar nerve can be seen that it is right in between the two roots. As we move then distally, we see that the canal regains its architecture, and here the canal goes back to being completely circular. So a extreme caution needs to be taken while the extraction of this tooth. This tooth is grossly carious. This is going to be a very technical extraction for the doctor. As we move to the axial view, on the axial view, this is the right hand side. This is the inferior alveolar nerve canal. Here we can see that from the top, this is the tooth grossly carious. As we are moving inferiorly, we can actually see right here. I'm going to zoom in, and I want the doctors to notice how the inferior alveolar canal moves. So this is the inferior alveolar canal. As we are moving superficially, the canal is quite significantly distally present. But as we move apically, we can actually see that the canal actually goes right in between the two roots. This is the canal right here. It actually is right here. We can see that the canal has been compressed, and as we move more apically, we can see that the canal goes further. It is also very closely associated with the nerves or the roots of the lower right second molar. But this is the canal. As we move distally, we can see the canal goes between the two roots and then passes through the two roots and goes further distally. So if there are any further questions regarding this case, please feel free to reach to our team. Thank you very much.